Hello, everyone, and welcome. Today, we're going to talk about the concept of the window of tolerance and how trauma can impact this, as well as ways of being able to expand the window of tolerance. We'll also look at cultivating resilience and post traumatic growth. So, within the human mind and body, we have a mechanism that's designed to regulate our responses to stress. And this mechanism is known as the window of tolerance. It's really truly kind of the optimal zone where we're able to function most effectively, where we experience that state of equilibrium where stress is manageable. Within that window of tolerance, we really kind of feel that things are just right. We're at that calm and peaceful state. We're still alert, we're still aware of our surroundings, but we're not feeling anxious or overwhelmed by it. And this is where, again, we're best able to cope and kind of roll with the punches that life happens. Now, the window of tolerance is characterized by a sense of groundedness, flexibility, openness, curiosity, just being present and mindful. It's also the ability to maintain the emotional regulation, and it's where our capacity to tolerate life stressors exists. Now, there are times when we move outside of this window of tolerance, and this is normal, and this is, when we're experiencing something that's causing some dysregulation. And usually this is some sort of internal or external stressor that we are experiencing. Now, if we move outside and beyond that, we might be looking at, situations where we become overwhelmed or shut down in response to those stressors. Typical stress responses that we experience, fight or flight or hyperarousal, is when we are pushed outside the window of tolerance and our body is preparing to kind of confront or avoid danger. It results in increased heart rate, heightened senses, and a surge of adrenaline. This is really kind of an emotional state characterized by high energy, the fight or flight piece. So if we're kind of looking at this, the hyperarousal piece on this, if we're in a room with a tiger, a fight is literally, I'm going to fight the tiger. I'm going to try to protect myself from the tiger. Flight is, I'm going to run away from that tiger. When hyperarousal becomes overstimulated and we get pushed even further away from our normal window of tolerance, we may though notice feelings of extreme anger or panic, irritability, anxiety, and falling into kind of that hypervigilant state too. We may kind of, again, feel really overwhelmed and chaotic within those moments and have trouble bringing ourselves back down into that window of tolerance. Now, a startle response is also normal within this, but a startle response can also become over exaggerated when we get too far outside of our window of tolerance. Hyperarousal is the opposite of this, and this is, a state of freeze or fawn. Freeze, again, is a pretty normal, natural state within our central nervous system, within the states of stress responses. Fawn, though, is typically found just within those who have experienced trauma. It's more of a learned response. So hypervigilance or hyperarousal, excuse me, occurs when the trauma or stress is so overwhelming that we find ourselves shutting down physically and emotionally, leading to feelings of numbness, disconnection, and inability to act. It's really characterized by, feeling withdrawal or shame. You may see some flat affect within there too. Fawn is kind of placating the situation. So again, kind of going back to the concept of the tiger, when you are freezing from the tiger, you're hiding from it, or maybe that kind of deer in headlights look. Fawn is begging the tiger not to eat you. So why is the window of tolerance important, and why is it, crucial that we understand how this works? Well, put simply, is existing within that window of tolerance is what allows us to move functionally and rationally through our world. It has that, again, that emotional regulation piece to it. It's our capacity to be able to tolerate life stressors, and it's where we feel kind of most at our baseline, most comfortable. And this is where we want to be able to stay in order to feel most effective and most successful within our life as far as how we are engaging and interacting within our experiences and with others. When we're within our window, we have access to our prefrontal cortex, or that portion of our brain that is responsible for executive functioning skills, such as organizing, planning, It's about prioritizing complex tasks. It's also responsible for, rational and logical thinking, being able to start actions and projects, staying focused on them. It's also really good for practicing the self control piece of our regulating emotions, and practicing good time management. So, having access to those executive function equips us to be successful within work and relationships. We are able to problem solve more effectively as we move through the world and as through our day. And even when we have those kind of stressors or we run into some sort of barriers or hiccups and disappointments and challenge, if we maintain within that window of tolerance and have access to our prefrontal cortex, we come out of it better. We're making more effective decisions to handle stress. When we are outside that window of tolerance, we lose access to that prefrontal cortex and those executive functioning skills. And this may default to the more instinctual skills where we may take very panicked or very, instinctual reactions to something. We're reacting without thinking, or we may, make no action at all. Again, the freeze response. Outside of the window tolerance, we also may be more prone to doing things that self sabotage, making choices or falling into patterns of behavior that really kind of undermine our better functioning, undermine our own experience or our relationships with others. So clearly, it's ideal if we stay inside the window of tolerance to have the best life and live the most functional and healthy life possible. But again, you are going to bounce in and out of it normally in response to certain stressors. That's how our body is designed. But also, our body is designed to bring us back into that regulation and to keep us within that equilibrium within the window of tolerance. So, at any point in time, we can move outside of it, and we may find ourselves in a non-ideal kind of emotional regulation zone sometimes, where we are more prone to anger or making rash decisions, or again freezing or having a non-committal response to certain situations. Again, that's just part of normal human condition, and it's completely natural to be able to do so. So the goal really isn't that we never move outside the window of tolerance. It really is kind of understanding how to grow our capacity to stay within it or be able to kind of rebound and be resilient so that we can move back to it quicker and much more effectively. And we can get back to more of that rational thought and choices and the emotional regulation. Now, the window of tolerance is also very subjective. We are all born kind of with our own window of tolerance, and it looks very different depending on each person. Some people are just more naturally, tolerant of certain situations. They have a larger window of tolerance, and some people have a little bit of shorter window of tolerance. If you listen to my episode talking about, empaths, their window of tolerance is actually a little bit shorter because they're more sensitive to their environment and to the people within it. So they are more likely to kind of move outside of that window of tolerance and become overwhelmed much easier. And in regards to that, too, people who experience trauma definitely have a much smaller window of tolerance. So, our personal histories, whether or not we came from any kind of childhood trauma or any kind of trauma background, just our natural personalities and our temperaments, the support systems that we have, even our physiology, our health can impact what our window of tolerance actually really looks like. So, no two windows will look exactly the same. And so the way we respond to these windows and being able to kind of bring someone back to regulation may not be exactly the same either, although there are similarities in the exercises that we do to be able to regulate ourselves. As I've already mentioned, individuals with trauma are going to have a smaller window of tolerance. And that's because trauma can be insidious. It's worming its way into the central nervous system and altering the way we perceive and react to the world around us. Reactions to trauma are deeply embedded in our physiology, impacting our hormonal systems, the way our brain processes information, and even our genetic expression. So, trauma can be a heavy psychological burden, potentially causing a myriad of emotional effects ranging from fear and anxiety to depression and guilt. Psychologically, it can shape our beliefs about the world and ourselves, often leading to destructive patterns of thinking or reacting that can persist long after the traumatic event has passed. So, it may mean that those with trauma history may have to work harder, longer, and also more deliberately at expanding or even healing their window of tolerance or coming back to it at a much quicker pace than maybe they have in the past. Now, it's not to say that we can't do it, it's just going to take a little bit more work to be able to do so. In looking at strategies for expanding our window of tolerance, we have to again understand that the window of tolerance looks different for every individual. So those strategies may be similar, but again, we're going to have to individualize them for ourselves. But we need to make sure that we start off with developing a foundation that really helps us to have a healthy and regulated nervous system. And this, is really kind of looking at what are we doing to provide ourselves with supportive self care? How are we taking care of our body within that supportive self care? And that involves getting enough sleep, getting enough exercise. And for those that maybe aren't as mobile, sometimes that can be difficult as far as getting exercise. So, what can you do throughout your day to do just some movement, just to get some flow going on within your body? Making sure that we're eating nutritious foods and we're refraining from any kind of substances that, may be negative to our health. And also that we're making sure that we're attending to our medical needs, that we're taking in the medication that is prescribed to us appropriately, and that we're seeing our doctors regularly and following up with what their recommendations are. We also need to provide our mind with supportive experiences. So this could be, making sure that we have adequate amounts of stimulation throughout our day. And not meaning that we're just kind of sitting there watching videos online or playing on our phones, but we're doing things to actually get our mind working and functioning. And again, creating a little bit of higher order thinking going on within there. And the stimulation really needs to have adequate amounts of focus and engagement. So again, you're not just sitting there kind of watching something, but what are you doing to actually engage within it? Making sure again that we're getting adequate amounts of rest. And we also are giving ourselves time for space to, just be able to take care of ourselves again, but also play. And that we're doing things that are engaging and fun for ourselves. We also need to make sure that we're providing ourselves with supportive experiences of relationships and social interactions. Making sure that we have friends that we're engaging with, or that we're engaging in social activities that we really enjoy. Also, being connected to something that's bigger than ourselves is important to this. And this could be something that we're looking at as far as like a spiritual focus, whether or not someone may attend church or other spiritual interactions. But it also could be, how do you interact with nature? A lot of people feel very connected with getting out there and getting involved in nature. But if it's not something that's kind of wide range like that, and maybe what are something else that you can do to be, involved in activities again that are about supporting the community, or supporting a cause that's really important to you, something that you feel gives you meaning, for yourself, and where you feel connected and that you feel a part of a greater whole. We also need to make sure that we're tending to our physical environment and that we're making sure that we're setting ourselves up for success. So, this is making sure that our living and working spaces are healthy for us, that we're finding ways or encouraging ways within these environments to reduce stress instead of increasing them. Or if we are in a stressful environment, that we have good tools again to be able to use to mitigate those responses. We also want to make sure that we design our external environments to be nourishing as well. So, what are we doing outside of our own individual lives? Again, engaging within that social context so that we're, finding things that are enjoyable and things that are giving us meaning, as much as possible. And they're not things that are depleting us. The second part of the work that we have to do towards expanding our window of tolerance really kind of focuses more on how do we cultivate and how do we build a wide range of tools that we can use when we find ourselves outside of that window of tolerance, when we find ourselves not being able to emotionally regulate and then we have the coping skills that we need. And again, this is inevitable. We are going to find ourselves outside of the window of tolerance, and we need to be able to have the tools to help us get back there. So this may involve, things that we do to practice resiliency and ways that help us rebound when we've been going through a stressful situation. We do this work by developing practices, habits, routines, again, having tools at our hands, and also having both internalized and externalized resources that help us soothe and regulate our nervous system, redirect ourselves, and ground ourselves. So some of these techniques include mindfulness and grounding. That my channel is full of different exercises with this and will continue to grow along those different things. And there's so much out there to help with mindfulness. And they're powerful tools that can help bring individuals back, um, to a regular state within their window of tolerance. And techniques, are varied from focused breathing, meditation, or any kind of sensory experiences that really kind of anchor us in the present moment, reducing the fight or flight or freeze responses. Grounding techniques, again, are part of those mindfulness that, again, bring us back to the present moment. Most grounding techniques are very sensory driven, but they can also be thought driven. Like one technique that you can do is, name as many different movies that you can think of, and just get your mind off of whatever's bothering you and focus on something different. Um, Sometimes, though, some of those tools may be therapy, and looking at engaging in therapy and learning different approaches and interventions through therapy that you can use to, again, expand your window of tolerance. And this is something that's going to be, again, more individualized as you work with your therapist, and defining what works best for you. All therapeutic approaches are really going to start to make sure, again, though, that you're focused on emotional regulation. Now, of course, you're going to have a lot of therapists that are just going to jump in and they're going to be very solution focused, and they're going to be like, okay, let's get in here and let's solve the problem. If we're talking about trauma and if we're talking about a dysregulated state of being, we have to work on the emotional regulation first. So it's very important, if you're engaging in therapy, that you're clear with your therapist about what your histories are and what the daily struggles that you experience in regards to your emotional regulation. But some of the therapeutic approaches that are helpful with this include cognitive behavioral therapy, especially if mindfulness is tied with that as well, dialectical behavioral therapy, and trauma therapies too, whether it may be trauma focused CBT, whether it may be EMDR, or many other trauma based therapies that are going to be helpful in developing that emotional regulation and really having resources that emphasize safety, trust, collaboration, and empowerment. The journey towards resilience is, an interesting one as well. Resilience is really not so much an innate trait, but it's a skill that can be fostered and strengthened. Now, that's not to say, though, that some aspects of our resilience are things that we are born with. Like for some people, their health may be part of their resilience, and that's kind of just a physical thing, but again, can be fostered and strengthened. For some, it may be their intelligence, or others, again, just they're born with this level of tolerance that exists in a certain way that could be resilient for them. But when we're talking about skills that could be fostered and strengthened, this really looks at the things that can help you bounce back from adversity, that can be really nurtured through various practices. Again, some of the ones that we've already mentioned, but also through relationships, working on shifting your mindset within there, and having a good supportive network for yourself as well that really positively influence our capacity to handle life's challenges. We also need to really look at an understanding post traumatic growth. Oftentimes, especially when we're caught up in just the noise of trauma and everything that's still kind of rolling around in our heads, with that is, sometimes people think, well, I survived the trauma, I'm here. But that's where they think as far as they can go. We're talking about trauma survivors. But really, you can experience post traumatic growth where you become a thriver. And this is a profound transformation where individuals emerge stronger. They have a deeper appreciation for life, enhanced personal strength, and a newfound purpose or pathway. And again, this starts with this emotional regulation piece, this piece of being able to expand our window of tolerance or come back to it quicker when we are experiencing hyperarousal or hypoarousal, and learning that that doesn't have to be your everyday experience, that it happens, it's normal, but we can come back to it and we can be okay. And again, that post traumatic growth is going to come through therapy, and it's going to come through a lot of work that you may do on your own, including, finding connections to social supports and maybe even spiritual practices too that help you continue to expand your identity of self outside of your trauma. So, the window of tolerance, again, is just an innate part of ourselves. It's in every individual, it looks different for individuals, and it is something that we can cultivate and we can grow and we can expand as we continue to focus on our resilience, focus on our emotional regulation, transcend our trauma, and expand the horizons of our own healing.